let's dive back in at the nursing process. So we're going to look at a few examples of questions that you might find that are specific to parts of the nursing process. Now, keep in mind, every question that you're going to use on the NCLEX is, they're geared toward the nursing process, but this will give you another way to kind of think about how we might use that to make questions, and gives you kind of an idea of, as you're going through day-to-day client interactions, how that might show up on your exam. So for assessment, which finding is most concerning in a post-operative client? Well, so if we were going to put choices to that, what kind of findings would actually give you concern? So it says which is most concerning. So all 4 of them have to be of some concern. Which things do you not want to have happen in your post-operative person?
Bleeding of any sort?
All right, I don't want any bleeding. So I don't want internal bleeding, and I don't want bleeding I can see either. What else?
Temperature.
What about their temperature?
Elevated.
How elevated?
Above 100.
100.
Okay, so I really don't want their temperature to be over 100, 101. What else?
Hypotension.
Hypotension. Does it matter if we qualify it with how fresh post-operative they are? So like if we say that they are 2 hours post-operative versus 24 hours post-operative, then the which is most concerning changes, right? So go ahead and think about those. Now, like one of the things that might apply to both scenarios is low urine output. It wouldn't matter if they were 2 hours or 24 hours post-op. If their urine output has dropped, then I'm still worried that they've got an internal hemorrhage or sepsis or some other underlying thing that I haven't noticed yet. If their temperature is 103, at no point was that going to be normal. So I would still be concerned about that. Just from those couple of examples, which one are you most concerned about?
Urine output.
Why would you be more concerned about urine output in post-op? What does urine output really measure?
Blood being filtered.
Perfusion.
It measures perfusion. So when somebody's not getting perfused because maybe they have an internal hemorrhage or they're going into septic shock, one of the things that you might notice pretty quickly is that their urine output starts to drop off, because that's one of the first things that the body's going to start to shut down. Which assessment data most indicates to the nurse that the client is experiencing a complication? So you could insert any kind of condition, any kind of surgery, any of that kind of stuff into this question in order to make it an NCLEX question to practice with. So throw me a scenario that you had this week. Somebody was in with, give me a condition. What kind of people did you take care of this week?
Pregnant.
Ischemic stroke.
Pregnant?
We're in OB.
Ah,
That's a condition.
that's definitely a condition. Let's go with ischemic stroke. All right, so your person's in with an ischemic stroke. What indicates that they're experiencing a complication? So what's the normal course for an ischemic stroke versus a complication? What kinds of things do you start to expect to see versus something that's going to make you panic a bit?
You might expect to see maybe some sort of weakness in the area.
All right, so unilateral weakness. So unilateral weakness might be normal. What if they develop bilateral weakness?
Maybe a problem.
That might be a different kind of complication. So the stroke is significant enough on its own, but then if we take that and say, okay, what would be a complication for this? That might be one. What if they didn't have a headache and now they do, right? So the stem doesn't say that they have a headache, but one of the choices is that the client complains of a 9 out of 10 headache. That's a change, and that might indicate what?
ICP, increased cranial pressure.
Increased intracranial pressure, right? Which assessment is a priority for the client with hypoglycemia? So you could put anything in there. What comes to mind for hypoglycemia? Assessments. You want to know if they're oriented, right? Okay. So what if I made that more specific and said the client is oriented times 2? Is it still a priority? Depends on what the other answers are, right? okay? So if I say they're disoriented, that's easy. I can say that that might be a priority. But if they're oriented times 2, then I'm thinking, well, I mean, they've been sick, so maybe they don't even realize they're in the hospital. That could be 1. What if they are irritable or lethargic? Irritable, lethargic, confused. Which one of those might be more concerning?
Lethargic.
Why?
To know which way you need to give medication.
Or if they're lethargic, they're not very good. Well, with lethargy, that's the one that poses more of a health problem. You could be
Why?
irritable by anything, you can be confused, but the lethargy, like if you're trying to think it out.
Can't protect your airway, is that what you're thinking?
No, it's just which is most concerning.
So if we go with the idea that that lethargy is more concerning, what reasons might that be more concerning than somebody who is awake enough to be irritable?
Because they can't control their airway.
They might not be able to control their airway. What else? What does it mean has happened?
There's been a
Change.
There's some sort of change that's happened mentally. So somebody who's confused has to be awake. But somebody who's lethargic, they've had a different change beyond that. Somebody who's irritable might be experiencing low blood sugar or might be experiencing, hypoxemia or that kind of thing. But if they've progressed from irritable to lethargic, that's another issue. We could take that example to our newborns, right? An irritable newborn is a problem. Like we want to figure out if their blood sugar is low, for example. But if a newborn is lethargic, that sets off all kinds of alarms, right? We're not talking asleep, we're talking like we're doing pricks and moving and harassing and they're lethargic. So that's a problem. Priority assessment for a client with a blood pressure of 210/103. What else do you assess next? It's pretty hypertensive, huh?
You'd assess their orientation.
Yeah, you want to see if it's affected their cerebral perfusion next. That would be your primary thing. Priority assessment for a client with a bloody stool.
What color is it?
So we might want to see what the stool looks like. What about the amount? Because it makes a big difference if we're talking a commode full of bloody clots versus a small amount of dark stool, right? What would you assess besides that?
Maybe blood pressure?
You want to get their blood pressure and their pulse first. So assuming you know what kind of bloody stool they had, the next thing you're going to do is try to get vital signs to make sure they're still stable.